How did we get to the point of doctors at health insurance companies actually being responsible for the deaths of patients? Who invented this system? How did this all begin? Where did the HMO start? Thanks to the wonders of magnetic tape, we know.
We have now narrowed down the Vice President's problems on this thing to one issue, and that is whether we should include these health maintenance organizations like Edgar Kaiser's Permanente thing. Now let me ask you, you can hear, you know I'm not too keen on any stand This is a private enterprise one. Well, that's good. Edgar Kaiser is Permanente deal for profit. And the reason he can do it, I had Edgar Kaiser come in and talk to me about this, and I went into it in some depth. All of the incentives are toward less medical care, because the less care they give them, the more money they make. It's the incentives are the right way.
Taking the patient off the table, and I felt that I was not able to provide the care and the need the person needed because I had to take the patient off the table. I had a patient who had serious heart problems, and they came to get a procedure done at our hospital. The doctor wanted a less invasive procedure to evaluate the patient, so we decided to go for a CT scan. In the middle of our CT scan, we got a call stating that there was no pre-authorization for this procedure and we had to stop. And we had to take the patient off the table and take her back to the cath lab. But it was heartbreaking having to take your patient off the table for a procedure that should have been simply done because it was warranted.
We agree with Senator Sanders.
I fight for Bernie with every breath I got left. I have no choice but to fight for everybody else because it's too late for me. But it's not too late for you. I can't do much. I can't phone back too much because I run out of breath. I can't knock on doors. So I set up my home for people to come over. You want a Bernie sign? Come here and get one. You want a Bernie sticker? Come here and get one. You want to learn about Bernie? Come on over. I'll tell you all about it. My family's had a history of lung issues, and my co-pays were $20 a piece with the original medical company, and I have 3 medications, so that's $60 a month. The company I work for was bought out, so they changed the insurance to Pan American. So now instead of only paying $60 to $90 a month, I'm paying over $800. I couldn't afford it. So I had to go without medication. I was at 87% lung function. I finally went to see my lung doctor, which I couldn't see because the insurance company would not cover them because they were a specialty company. So I walked in and saw them, and she looked at me and checked me out. She goes, "You're dying." My lung function went from 87% to 42, and so I had to retire. If I had Medicare for All in 2012, I'd still be working. I wouldn't be sitting here dying in my home. And I don't want that to happen to anybody else. I want everybody to be able to live their lives without having to worry that you're going to die because the insurance company just doesn't want to help you anymore. Or the company you work for doesn't care. My lungs may be failing, but I'm going to fight for Bernie with every breath I have left.
It's too much. They know they can't afford it, and they're just going to go to bed when their 3,4-DAP runs out.
So you have a situation where the product that you have to take for your health will now cost you an unaffordable $375,000 a year.
Yes.
What is the cost of a human life? If it costs too much,
is virtually doubling the federal budget.
just give us your health care. I am 67 years old. Almost 33 years ago, I was diagnosed HIV positive and given 2 years to live. I was covered with Medicaid. If I did not have this medication, I would not be sitting before you. Currently, the medication I'm taking costs more than $1,000 a month. The same medication costs $3 in Brazil and India.
When the juice is $1 and they're selling it for $600, the market forces aren't at work.
These pills do not cost that much money to produce. The drug companies say that they need it for research.
What did it cost to develop the drug? $1.1 billion. So billions of dollars to develop this amazing drug.
Yes.
That is a bold-faced lie. The research they get is funded by universities that are funded by taxpayers' money. In every country I've been blessed to live in, I was able to get health care. When I was in Germany, I went to get health care, and I went into my pocket to give money, and they looked at me like I was crazy.
My son was dying. My son was, undiagnosed. He was only 3 years old. Collection agencies found out we did not have insurance because my husband had lost his job days before. They came into the room wanting to know how we were going to pay, wanting credit cards. There's no way out for us.
Now they're saying that, I didn't re-sign or do something or something.
How are you going to pay off?
I can't. I'm going to kill myself.
Hold on, John, stop it. You're not going to kill yourself. All right,
I can't deal with this. I have Huntington's disease. Do you know how hard that is? You probably don't, do you? I can't drive. I can barely take care of myself.
$1,000 got me 6 months of insulin for my son. And what's so incredible to me, I paid $1,000. That's still less than what I pay a month in the United States. How can we be the greatest country and I am paying that much? People always say, oh, you're being too vocal. I don't feel I'm being vocal enough. Right. We are not being vocal enough. When is enough enough? How many more? Get louder. Yeah, we got to get louder. How many kids are going to have to make this sacrifice and die? Yes. Think how many had died because of this. I could have lost my son because of insurance and because of pharmaceutical, because of greed. I think, how can you sleep at night knowing that kids can't afford insulin? How is that possible?